Good evening, Peter Goertz. I'm a psychiatrist. Delusional or not can be very tricky. So this week I saw a patient. I just saw him one time and I actually did not review the chart before I saw the patient. So I didn't really know what was going on. And he started telling me about issues with a family member. And I talked with him for about 5 minutes. And then later on, I spoke with the resident, so the junior psychiatry doctor, and she said that, well, first of all, he was telling me things that I felt were conceivable and I believed them. But then when I spoke with the junior psychiatry doctor, it turns out they had felt that he was delusional. So I thought, wow, did I really buy into something that was delusional? And that can happen. So we want to be open-minded, and we want to, at the same time, also balance that with keeping common sense. So we want to be open to believing Galileo Galilei when he said the planet was round, but we also want to not necessarily immediately believe someone who says aliens put a computer chip in their brain. So this also reminds me of a friend of mine years ago. I was 23 years old, living with my girlfriend, and a mutual friend of ours called me up one day and he said, "You and your girlfriend will never have to work again in your life." I said, wow, because we didn't have much money at the time. And he said, "Come on over, I'll tell you all about it." So I came over to his house and he was telling me things. Again, I try and stay open-minded. I enjoy being open-minded. But that evening, he was telling me, oh, the clock is saying 9:08, and that means such and such. So things that were, in hindsight, not the usual things that he was saying. And then later on, I picked up my girlfriend from work and she came with me to his house because I told him, something was going on with him. And she was sitting there listening to what he was saying. And then she said, "Are you all playing with my head?" So she got a little annoyed, thought we were trying to fool around with her. But I actually had at least somewhat bought into it, believed what my friend was saying. She absolutely did not believe it. She, at that point, turned out to be correct in hindsight. He was actually then hospitalized in a psychiatric hospital. Another example is a patient I saw years ago who had been saying that a neighbor was harassing her at all hours of the day and night, and had even installed a video camera in her apartment. And I thought she was entirely delusional. I was her doctor in the hospital, and it turns out a neighbor ultimately admitted that he was harassing her day and night. However, he had not put a video camera in her apartment. So she was, to a large extent, not delusional, but to an extent also delusional regarding the video camera. So it's tricky. Someone can be delusional, not delusional, or then there can be a combination, like in that patient I just mentioned, a combination of delusional thinking and non-delusional thinking about a given topic, which is especially tricky if you're a psychiatrist trying to figure out what is going on with a patient. So some things that can help to try and figure out if someone's delusional. There's no blood test, of course, or a CAT scan that can determine someone's delusional. But collateral information, for example, from the family, can often give you a feel. Is that patient delusional? Is the patient not delusional? The family, of course, is also not always reliable. Also, A patient's level of functioning, let's say at work, in interactions with their family, friends, in hobbies. If someone's enjoying their life, that can give you an idea, are they really suffering from delusions or not? So their level of functioning in various areas can be helpful to look at. So are they doing well overall? Are they enjoying their life in various areas, socially, at work, etc.? Or is this someone who's not eating because they're paranoid, not showering because they're so mentally troubled that they're not able to do so, let's say from depression? Other symptoms can give you an idea. If someone's hearing voices, in addition to possibly being delusional, that may give you an idea that maybe they are delusional. But again, you can go wrong. It's tricky. If someone is severely suffering mentally, that can give you an idea. So if they're severely depressed, if they're manic, there might be a higher chance that they're delusional. But it's tricky. Thank you.